Hi, I'm Wanda, and this is David. I'd like to introduce you to David. He's 35 years old, and he is who I'm going to be doing my health risk assessment on. David, could you just tell us a little bit about yourself?
Yeah, I'm a special education teacher at Hugh Mercer Elementary School here in Fredericksburg, and this will be my 6th year in special education.
Okay, so what we're going to do today, David, is we're going to talk about some of the health risk. I did do a family genogram of your, as you can see here, bring this a little closer. We have your grandmother who is still alive, your maternal grandmother, your maternal grandfather who's also alive, your paternal grandmother, she died from a heart attack, and your paternal grandfather is still alive also. Your mother and father are also alive, and then you have, on your father's side, you have 2 aunts and 2 uncles, and then you also have a sister who is alive also. I reviewed with you some of your family medical history, and you do have the seasonal allergies.
Yes, ma'am.
Is there anything else that you would like to tell me about you?
I occasionally smoke about a pack and a half of cigarettes a day, and I do drink occasional beers on the weekend.
Is that occasional or everyday thing with the smoking?
I guess it could be every day.
Okay, and then the drinking. Do you drink 12 or more beers during the
Yes.
time that you do
Mm-hmm.
drink?
Yes, ma'am.
Okay, so we will eventually go over some health risk regarding that.
Okay.
The main thing that I noticed throughout your family history is that they have diabetes, high blood pressure. There is a history of high cholesterol and lung disease. So I did identify 3 risk factors involving you. And the first one would be the lung disease, just because you do smoke 1.5 pack of cigarettes a day.
Mm-hmm.
So you know what the risk for smoking
Yes.
cigarettes is.
Long term, yes.
Yes, because your grandfather has a lung disease and your aunt also has COPD, which is a lung disease. Cirrhosis of the liver. Of course, it's not good. Occasional beer is good, but when it's more a consumption of 12 plus beers per week, you do risk developing the cirrhosis and all that. And then the diabetes, just because you have a very strong history of the diabetes, that would be something that we would want to keep an eye on and take a look at.
Okay.
Do you visit a doctor on a regular basis?
I do not.
Yes. So at age 35, that's something that you might want to consider, because that is also important to find out if you do have like pre-diabetes or anything. And the only way that they would be able to do that would be to screen for that. Do you have any questions for me at all?
No, I do not. Thank you for your time. I appreciate it.
So, what we're going to do is we'll go from here and move on to your physical exam.
All right, thank you.